She is the policy and research advisor of Abdul Latif Jameel Poverty Action RAP, popularly known as JBOL. She will be sharing with us effective use of innovation in the population and development information sharing lessons from JPOL. Madam Jo is also Mwalim. I use Mwalim for those ones who understand the Kiswahili. She is a lecturer, a senior lecturer in the School of Economics, University of Nairobi. Therefore, dear colleagues, the issue of data is something which we need not to ignore in this country. Agencies and organizations, for them to make effective decisions, then the issue of timeliness, quality, completeness of data is something which is important. And therefore, our concern as either institutions, governments, is that how can we be able to get the timely data, real time, and we have the capacity in terms of managing the data. How about the methodologies which we are using? Therefore, the session will be able to address those concerns. And we have got 40 minutes for our colleagues. After 40 minutes, I will be able to give it to the audience to ask questions and conclude. I like to welcome Madam Lilian Kimeto, our Deputy Head of Communications, to start us off. Welcome, Lilian.
Thank you so much, Aloyce. I will request the NCPD team to project my presentation.
Lilian,
in the meanwhile, can you hear me? Can you hear me, Aloyce?
Just go ahead.
Can you hear?
Okay.
Can you hear me?
Yes.
All right. Okay, so I was saying that I will request the NCPD team to put up my presentation, but I'll use a minute to introduce myself, just my bio. I hold a master's in media studies from Daystar University. I also have a postgraduate in mass communication from the University of Nairobi, and a BEd Education, English and Literature from Kenyatta University. I have worked in several government agencies, the DPP's office, Ministry of Housing, State Department of Livestock, and in all those places I've been able to design their communication strategies, the stakeholder engagement guidelines, the internal communication guidelines, the public complaints, and customer satisfaction guidelines, and more recently, digital communication guidelines. So that is my space. I have an interest in development communication, and actually my thesis was on participatory communication. I looked at a project in Kibera, and I have published 3 papers in the area. I have an interest, and I'm very passionate about development communication and participatory communication. That in a nutshell is what I'd say about myself. And now I'd like to move on to the presentation. Irene, please share it for me.
Is it somewhere who is doing it, or Eileen? One of the NCPD colleagues, kindly, you can project the presentation of Madam Lilian.
Cool. I don't know, is there a problem? I'm waiting.
What you'll do for the interest of time, you just proceed with your presentation, because I want to believe that wherever you're sitting, you have it. Our colleagues apologize for that, because I'm told Eileen is not in the room, but she'll be joining us later. But Madam Lilian, you can go ahead. Colleagues, take notes of what she's presenting. she has got 10 minutes, and if we keep on staying this way, then we may not move unless. But just go ahead because I'm not sure.
Okay. Okay. I'm guided. I'm guided. So the presentation I'm making this morning, this afternoon, is on effective communication of population and development data for decision making at community and policy levels. So the first thing I attempted was to give definitions. It's always good to define the terms. And for purposes of this paper, the term communication is the act of developing and sharing meaning among entities, groups, using mutually understood signs, symbols, and semiotic conventions. I have another term, concept, development for communication, and this is the use of communication to facilitate social development. I have defined data for purposes of my presentation as facts and figures collected together for reference or analysis. Then the next thing I have done is to draw a model of how communication takes place. How communication takes place, we have a source, we have a message, we have audience, we have, I don't know if, can I be given the rights? I wish I can just share from my laptop.
I suspect that you need rights also to do it from your laptop. But
okay, then I'll just proceed. I'll just proceed. Once people will get the presentation, they will
share from your laptop. You can share.
Yes, you can. Okay, just go ahead.
Okay, just give me a minute. It's on the desktop. Just go ahead. Okay. Yeah. Just a minute. The share button is inactive. I think share, I think I'll just continue because the share button is inactive. So once the presentation will be shared, participants will be able to appreciate. But basically, communication is a process, and it always starts with a source. It travels through a medium to an end or a receiver. And this process happens within a context. And there's always a feedback that comes out of that process. It could be positive or negative. And then there's noise that can also happen. And the noise could be cultural, mechanical, or anything else that would impede understanding. How does communication take place at the source? There are several types of sources. You can have interpersonal sources where people share information one-on-one, like at the family level, colleagues, or a government officer visiting a farmer, a veterinary officer visiting a farmer. They could be mediated through ICT, where journalists prepare messages and broadcast them, or politicians in their meetings, or intrapersonal, the conversations that take place within a person, you know, where somebody is asking themselves, why do I have many kids? Why do my crops always fail? Then we have different types of channels that carry those messages. They can be interpersonal, and that is, we share them with personal contact, you know, like women discussing their families, a number of children at the water points, phone conversations between business people, doctor visits, social media engagements, and all that. And then we have mediated, where you have one message, but you're projecting it to a large number of people at the same time. And that happens through media, either the traditional radio or the social media. So having explained then how communication works, then we now come to, so does population have a role in population and development data? Obviously it does. It helps us to carry, it's useful as a tool to carry interpersonal engagements within groups through mass media or mediated methods. And in that way, people are able to listen to each other, and even the government or agencies can harvest indigenous knowledge from the communities. Communication also makes population and development issues vernacular and specific to contexts, because population issues touch on every facet of human life. Communication does create an ecology, the ecology that is required for development discussions to take place, for the government to speak to the farmers, for the physicians or the medical practitioners to speak to the women on medical issues and all that. That is that's where communication comes in. It creates that favorable ecology, and communication specialists come in to give solutions to challenges that arise out of the interactions. They could be ecological, political, cultural, or basically any disconnection or dissonance issues within that ecology. For example, right now there's a question of, do we vaccinate or don't get vaccinated against COVID-19? Communication enables data sharing to a wide range of audiences, and those audiences can be anyone between the policymaker and the rural community, the development partners, and basically everyone who is taking place in the development process. Effective communication requires a strong understanding of audiences in terms of their knowledge, their beliefs, their cultures, their own areas of expertise, their attitudes, their perceptions, values, and ethics. All these differences are, it's very important to take into account these differences when data is being presented to different audiences, and even how to segment those audiences. Communication engages stakeholders in such a way that you're able to assess risks and opportunities and use information exchange, the information exchange that is happening, to really seek whatever social change that you're desiring. So I think those are the few roles that communication can help. And then now we can ask ourselves, I've talked so much about audiences, and I just thought it's important for me to just give the characteristics of these people I'm calling audiences. It can be the public, and the general public, really their characteristics are defined based on their geographic location, levels of education, socioeconomic status, the gender, the age, and all that. And the general, in the context of Kenya, the general public receive their information from their opinion leaders, from their family, friends, their networks, from the social media, and their opinion leaders, who in this case are our politicians. We have another category of the policymakers, and who are these people? They are hardworking. The level of education obviously is high. So these are individuals who appreciate financial implications. They possess intuitive decision-making qualities, and they are always looking for certainty from experts. And these people get their information from interpersonal sources and the news, and they are always, as they look at this information, they are always trying to see how they support their processes, the kind of things they are doing. If it is a minister, he'd like to see how communication would be enabling the kind of things that he's doing at his ministry. The media, I pulled out the media because they are very important. And the media has its own set of values and beliefs. They're always concerned about framing development issues, but sometimes they have a very low understanding of policies. And I guess the population policy would be one of them. And they get information largely from trusted experts like the ones in this room today. So having looked at, just given the characteristics of what audiences look like, I also sought to just give us a little snippet of when humans receive data. Do they just consume the data as it is? Sometimes yes, but sometimes no. And it could be because of some of the biases that they have. One bias is that of heuristic, the representation. I have my own implicit knowledge. I have my stereotypes. I make my own judgments. If we take the example of cancer, for example, when a communication expert is messaging on cancer, there is already a perception in the minds of many people that cancer is a death sentence. So it becomes even difficult to communicate to those individuals that cancer is a broad set of diseases that many times they are slow growing and can be treated if detected early enough. We have another, people also process data through the way they anchor and adjust to their own biases. For example, if you tell someone that if you take malaria tablets without a diagnosis, it would give you side effects if you didn't have the disease. And they will listen to that piece of information, but will only adjust their mindset if indeed what you're trying to tell them happens. Then the other thing that creates biases as human beings consume data is the humans have a strong tendency to believe that if two types of data are correlated, then one has caused the other. For example, if a certain demographic information shows that where there are many religious houses, there is also increase in crime, people would think that the increase in religious houses is increasing crime. But it could just be that there's a third variable that is accounting for both increase in the religious houses and crime. Then there is randomness. Humans tend to consider chance and randomness as explanations for sequences, events, and occurrences. For example, if there's where clusters of birth defects occur, public speculation will always try to attribute that to witchcraft and things like those, yet it was actually just chance. So having, at this point then, I'd like to make a case for integrating communication into development processes, or when we are rolling out data on population and development. It's clear that decision-making processes in government is both complex and multi-level. And so communication would be that tool that would help us to engage the different segments of audiences at their level, in their language, in their context, in their situation, and in their condition. Communication can be utilized to appreciate organizational cultures of different institutions who have a role in the policy. For this case, it's a population policy. Because these organizations have different mandates, they have different notions of communication, there are different program priorities in their programs, and even budget decisions. And so it would help the NCPD if they use communication to determine how to engage those institutions so that those institutions interpret aspirations of the population policy as desired.
Lilian, you have got 5 minutes. You should be winding up.
I will be done. Also, communication for development would support the achievement of policy outcomes through crafting of messages that define roles of all players in the population and development data cycle and how citizens' expectations can be met. For example, when we say that we want to achieve a digital economy, what is the linkage between this aspiration of the digital economy and the population policy and the country's development agenda. Communication would be able to create those linkages. Communication makes data talk, and we're able to understand, obviously through audiovisuals, the graphics, the videos, the pictures, and that helps citizens and communities to build knowledge around the issues that are being framed for them. Also, communication deploys, a communication expert will always deploy the right language, if it is Braille, if it is sign language, and this is to address inclusivity of persons living with disability or semi-illiterate. And this then means that you have touched every segment of the population and you have achieved understanding, ownership, and support of the policy across, right from the top to the bottom. And then I came up with three possible ways, three possible methodologies that can be used. Storytelling, and in this case, I took an example of a boda rider as my primary audience. And storytelling would help me build knowledge of the boda rider and link his own personal safety with the country's mortality rate, to let the boda rider know that he should not, his own safety, he's a very valuable person, and his own safety means so much to the country. The other is cross-media approach, where you basically carry one message across all platforms, whether it's the traditional media, the new media, the barazas, the institutional websites, and that convergence stimulates the kind of conversations and active use of data, and then people start to use data to make their personal or corporate decisions. The other one is participatory communication, and in this approach, you basically recruit the citizens to become the champions and the carriers of the communication. You become co-creators of the messages, and they become the carriers of those messages to the people they influence, their communities. I've given a scenario as I close. Picture an expectant mother with 5 kids who are all under 5 and living with a husband who is drunken in a single room in a rural area, and they are on a quarter piece of land. How can one communicate to this family the need to family plan, and you do it in such a way that you don't infringe on their cultural, religious, and personal space? As we think about that, I will give the way forward. Maybe we can type on the chat what our thoughts are about that situation. And so the way forward for me is for this national population policy to gain traction, to be known, to be understood, it would be important if NCPD would use a communication plan to articulate it, and that plan should be embedded in the implementation plan, funded and evaluated also, so that you're able to get to understand the outcomes. My other proposal would be the empowering of the communication function within that organization with the requisite skills and training, so that they're able to disseminate statistical data to the kind of audiences I've already explained up there. And once you have that focal point, you have consistent messaging, you have engagements, and that
Madam
becomes
Lilian, your time is up.
Okay.
Yeah,
okay. Then the last two is running a national targeted campaign across the country and engaging the media to frame issues on population and development positively. I end my presentation by a quote by Winston Churchill: "Healthy citizens are the greatest asset any country can have." Thank you.
Yeah, thank you so much, Madam Director Lilian, despite having some challenges, but you've done it well. And I want to believe that your presentation will be shared for the interest of our audience, because they may also need to make reference to the same. But still, we encourage our audience, if you have picked some issues, then you can be able to share in the next session, which will be question and answers. Now, let me welcome Commissioner Madam Kassait. She is from the Data Protection Commission Office. She'll be sharing with us issues to do with the data protection, because issues of privacy in this country is a major issue. How can we be assured that our data is safe, even those people who provide the data? Thank you and welcome, Madam Commissioner.
You go and record.
Madam Commissioner, karibu sana.
Thank you.
Can you see the presentation?
Yes, I can.
Yes.
Okay, thank you.
Yes, just go ahead.
Yeah, thank you for this opportunity to address you during this very important forum where you're basically discussing issues around population and the theme revolving around innovation, data access and protection. I will try as much as possible to stick to even 15 minutes if you allow me, Chair. And you'll also allow me, Mr. Moderator, to leave after the presentation because we had projected would be done by midday, because we are running 2 parallel meetings at the same time. If that's okay, any questions, I can always address them. They can always be brought to my attention and I'll address them. I will quickly, in the presentation, the presentation basically is focusing on who the Office of Data Commissioner is. We will try during the presentation to dive in terms of innovation and all. However, I thought it's an important time to also create a bit of appreciation of what data protection is. And just on the first slide, you will see we have talked about the government collecting large amount of data on a day-to-day basis, and this include demographics. And at that, I would like to refer us to what the Data Protection Act defines as personal data. So personal data means any information relating to an identifiable or identifiable nature person. And that is something, and then I'd also want to refer you to the issue around, Mr. Moderator, there's a bit of noise in the background. Should I proceed?
Just proceed, but those ones who are not in the fraud, this is the
Sorry,
time for the
proceed.
commissioner.
Proceed. We are just trying to check on the next presentation.
Yes, Wambo, you can switch over then. Please.
So I wanted to, even as I go to my presentation, also bring to your attention what it means, because you're discussing demographics, you're discussing many institutions that collect data, what sensitive personal data means. It means revealing, sensitive personal data means the personal information on health, race, status, ethnic, socioeconomic, conscious belief, genetic data, biometric data, property data, marital status, family details, including names of person, children, spouses, sex, or sexual orientation. So it's important, even as you discuss data, for people to begin appreciating what the Data Protection Act, which is a new legislative framework, defines. So anyway, going back to the presentation, the government administrative authority, we of course are responsible for issues around data, are expected to collect and record and also put in canvas issue matters around data. Next slide. Next slide, please. When we talk about the data collection and analysis of population, it plays a significant role in development of policies, identification of areas of intervention, as well as national planning for the government. The development in the technology space has further led to, of course, new innovative ways of collection of data processing, and Kenya has not been left behind on issues. However, to ensure that we secure data and responsible use of data, and we need to have clear rules about how the data can be used, how it is collected, and the life cycle of the data. So moving to the next issue, which is around data privacy, the government of Kenya values the issue around privacy and protection of personal data for citizens, and further recognizes the protection of personal data is an essential element of maintaining public trust. The right to privacy is acknowledged as a basic human right in Kenya and is espoused in our Constitution of 2010. Next slide. The Data Protection Act came into force in 8th of November 2019, and the office came into force in 2020, And under this, we pursuant to this, the data protection officer, of course, was sworn in November of 2020. The data protection 2019 basically provides a framework for protection of personal data. And you see, I went earlier to define what is considered as personal data. And being in an area of population, there is a lot you collect in as far as personal data is concerned. And therefore, it's incumbent upon you to make sure that that information is secure, it's safeguarded, and that the privacy of individual is something that you take into account. The Act, of course, as an expectation of the Act as an office, we are supposed to have in place safeguards and make sure that the data is collected in a transparent and responsible manner, it is safeguarded, and that the storage of the information is done in a manner that is prescribed under the Data Protection Act. So moving to the next slide on operationalization of the Act. In Kenya, unless we have regulations, we're not therefore able to operationalize an act. So in ensuring that this happened, the Cabinet Secretary in January of this year did gazette a task force on data protection, the task force on regulation. The task force has since completed the 3 sets of regulations, and the 3 sets of regulations are, the first one is on the general regulations by the Cabinet Secretary. These regulations are supposed to make sure that the procedures adopted by the Office of the Data Commissioner, the general regulations are supposed to ensure that the rights of the data subjects are well taken care of, and the duties and responsibilities of data controllers are known. And I believe some of the people who are present in these forums are actually data controllers and data processors. And a data controller is the person who actually collects the data. Assuming in the health sector or where we are right now, you are collecting information about the status, the family planning status of women. You who is collecting that information as an institution, you're the one who is called a data controller. If you have perhaps a company who will then do the analysis for you in terms of how this information has been, what it is for, and the trends, then that is the data processor. So the general regulations are supposed to guide you as a data controller and processor in as far as this is concerned. 2, the second set of regulation is on registration. At the end of this process, we will be expecting all data controllers and data processors, anybody collecting data which I described, to register. So once you register, you are supposed to be registered with the data commissioner. If you don't register, they're not allowed to collect data in as far as personal data is concerned. 3 is enforcement. Once you collect data, and you're not adhering to the principles set out in the Act, there are penalties for data controllers. So essentially, these 3 sets of regulations are supposed to help operationalize the Data Protection Act. So I will go now to dive into, because when people talk about data, many times people assume or have not appreciated what is expected of you. Just to give you highlights, because this also has an effect in terms of how you collect data, it has an effect in terms of innovation. What are the key principles and as prescribed under the Data Protection Act? 1 is what we call lawfulness, fairness, and transparency. If you're in this area of population, and assuming you're doing a survey, you need to ask yourself, why are you collecting data? Is it lawful in the first place? And when we say lawful, is there a framework that gives you that mandate to collect the data? 2, are you doing it fairly? And then 3, is your processing going to be done fairly? And is it going to be transparent? And when we say transparent, it is expected as a data controller, you will be telling the people who you're collecting the information from what this information is going to be used for. You can't just collect data and then you use it for one issue when you had already told your data controller subject it was going to be used for another purpose. Secondly is purpose limitation. When we say purpose limitation, we say that the data must be for a reason that is transparent and must not be processed in a way that it's out with its purpose. And I think I've explained that. The other one is data minimization. And I like to give an example with insurance companies. If I'm taking an insurance for my car, why would you need to know what my spouse, whether I am married or not? You see, if I am taking information on perhaps family planning, why do you need to know information on whether, that one is difficult. I'm trying to think which information don't you think? Because if I say, are you married? You might say it's important. But essentially what I'm explaining is don't ask for information that you don't need. Why do you need my email if you're asking about my family planning? Unless you want to share information with me, that is not necessary. And that is what we mean by data minimization. And so as you embark on data collection and discussing innovation, you need to appreciate some of these principles. Next slide. The other one is accuracy. Well, issues around data accuracy, it means that if today I walked into a bank and they collected my information and I changed my email address, I'm entitled to them correcting that information. That is data accuracy. That I can ask for you to make sure that the information you have about me is accurate. And I see there's a lot of, since we're in the context of national population, there has been a discussion in recent times in terms of intersex, I think. I think that would be an excellent example to give in terms of accuracy. Where would you describe me? Am I female? Am I male? Or what am I? So accuracy is an important aspect when it comes to data. The other one is storage limitation. When it comes to storage limitation, if you're collecting information about me and my health, you don't need to keep it for eternity. You need to, at some point, you need to get rid of that information. Of course, there's issue about integrity and confidentiality. As you collect information about me, you must put in place as an institution to secure my information. And institutions which I know are seated here today collect a lot of sensitive information. Who has access to this information? What are your policies in terms of access to this information? Who has the password to the information you have? Those are some of the issues when we say integrity and confidentiality, you need to take into account as you collect information. Accountability, of course, like I said earlier, you need to tell us why you're collecting one information and not for another purpose. That's an issue of accountability. Explain to me. Next slide. So basically, when we talk about principles of data protection, they apply in cases where data is being processed on a legal basis, and public authorities are at an advantage when it is collecting data of any intergovernmental organization sharing. The other thing I would like to say is, however, in sharing of data collection by public authorities and agencies for the purpose of decision making, public institutions should adopt digital transformation and must anonymize personal data if it is to be utilized by other public authority and even private sector. And finally, to clarify the concept of anonymization, it means you de-identify the personal data.
Commissioner should go ahead now. The time seems to be up.
I'm on the last slide for sure.
Thank you.
And then when it comes to, when we talk about data by design or default, which is a key issue, and it's addressed by Section 41 of the Data Protection Act. It means you as a data controller, when you conceptualize data collection and processing of personal data, you must put in place mechanisms that protect the data from when you collect it to when you process it to when you store it. So that is what we mean by data by design or default. Your entire data collection infrastructure, even if it is using manual means like files, how are you securing personal information? Do you have a safe? Who has access to this information if they are physical files? Do you lock them somewhere? Who analyzes them? Where are they kept? How do you dispose them? Once you have finished, are you just going to keep them in the archives, or are you going to make sure that there's a secure even as you dispose? So it is, the Data Protection Act is calling upon us as data controllers and data processors, even as we embark on innovation, that we must design our systems in a way that protects personal information, because we are not commodities, if I may say that. As human beings, we have the dignity. I have the dignity, I have the right to dignity for my information to be secure. I'm not a commodity. And therefore, as you embark on this, you continue with this conversation, have that conversation around what does it mean for our institution when it comes to designing systems that ensure that personal data is protected from start to end. So you look at the process end to end. And of course, many times we keep thinking that data protection is about digital. No, it's also about information that we collect that is personal, that could also be manual. I think I'll end there, and I wish you well in the next part of the deliberation. If you allow me, I will leave shortly.
Thank you, Madam Commissioner, for that presentation.
Yes.
Madam Commissioner had indicated that she will be leaving shortly. Therefore, I'll propose that our colleagues, you start chatting with her. If there are some comments, some questions to improve the presentation, we'll be happy to receive it. And at this juncture, let me introduce our colleague, another panelist, Dr. Damazo Kadengye, who will be speaking on behalf of the African Population and Health Research Center. Doctor, welcome. Maybe you can do now the formal introduction so that people hear your voice. Welcome. Okay. This is your time.
Thank you so much, Chair. I have shared, so I think the Secretariat may not bother. I hope my slides are viewable. My name is Damazo Kadengye, and I work at the head of the measurement. I work in Nairobi right now, and in my previous experiences, I've worked with the Centers for Disease Control and Prevention in Kampala, Uganda, as well as I've also worked as a senior lecturer for statistics and epidemiology and biostatistics at the University of Kampala and by University of Science and Technology. Today, I'll be talking about population and development data, basically looking at the innovation and utilization based on APHRC experiences. Yeah, just briefly, I'd say that at APHRC, we are a policy-oriented think tank and research institution whose mission is to generate research and evidence, strengthen research capacity, and engage policy to inform action on population, health, and well-being. And we've been working in this area since 1995. At the moment, we are operating in about 20 countries in sub-Saharan Africa. But ideally, our research areas focus on 6 thematic areas, that is aging and development, education and youth empowerment, health systems for health, population dynamics and reproductive health, maternal and child well-being, as well as urbanization in Africa. So for today, I really wanted to look at the key questions for so the 3 questions that the presentation is on is, how is APHRC leveraging its vantage point to build data pools across the continent to inform country-specific planning processes and development agendas? Does APHRC see itself becoming a platform with data to inform population planning and development? And is there a role for APHRC as a leader in research, advocacy, or policy to advance data utility on the continent? So traditionally, this kind of shows an evolution of how we've been dealing with the data at APHRC. So initially, we thought that the data, we could not share this data because we thought, okay, these are our data, we've raised the funds, so we don't need to share the data. But then at some point we thought, okay, data is expensive to produce, so people who want to access and use our data, they should pay to access it. And later we thought, okay, maybe we need the time to exploit our own data, publish using our own data. So we were calling this data our own. But then at some point with the open data movement, we realized that the data is a public good, and we needed to make our data our open access. And this was majorly to align ourselves with the Africa data revolution. Our understanding of the Africa data revolution is that this should be some sort of a partnership of all data communities that uphold the principles of official statistics. And this might include openness, having data value chains for learning, creation of a vibrant data ecosystem, and providing timely or user-driven aggregated data for public good, and generally to inform development at different levels of the country. So for us as APHRC, our approach to strengthening the data ecosystem is that we believe that the APHRC has a duty to improve data ecosystems in Africa. And we've been operating, although we are operating in Kenya, but like I mentioned, we're operating in 20 countries. So the data ecosystem might involve several value chains, including collection, publication, and impact. So we don't want only to collect the data and publish the data, but we also want to make sure that these data are used for decision making and policy processes. And this actually is in alignment with our mission, which is going beyond the data to influence change. So the principles for us have been the fair data, that data should be fair. That is, it should be findable, it should be accessible, it should be interoperable and reusable. And that we do this with our own internally generated data, but we also do this, we put in place initiatives for other sources of data that are within the African data ecosystem. And this needs the workforce, it needs the infrastructure, it needs the tools and analytics, as well as a community of practice. So here, basically what we've done is that we have a central data catalog at APHRC, which we call the APHRC microdata portal, where all our data, as long as we have, we make them publicly available for anybody to access, and of course you can follow sharing guidelines and obtain these data, and they can be used by academia and by other researchers. The other thing that we've done, some small strategic things, is that we are involved in evidence-informed policy making. So we have some projects which are trying to, where we are trying to work with the different subnational systems to improve data use. And this involves the review of the policy for data use. We have done, for instance, this review, some sort of a scoping review in Zambia, in Uganda, and Kenya, and Senegal as pilot countries. And when we do this review, they help us to develop training modules for improving the data utility across different levels of the country. Some of the work also we've done, we are doing right now, we've received some funding from our Bill and Melinda Gates Foundation to work in 6 sub-Saharan African countries to support subnational data systems through the use of work in Kenya, in Uganda, Zambia, Niger, Senegal, and I think Burkina Faso. That is also something that we are doing. The other part that we are doing that also involves improved utility is setting up the INSPIRE. The INSPIRE network is a network for sharing population information from research entities. So although we have the microdata portal, we think that we've put in place a common data model, a platform where health data from longitudinal populations is brought together safely and securely to help answer important research questions about health and population in East Africa and in Africa. But the bigger picture for this is that we should be having a data repository for longitudinal data studies in Africa. Right now, we have also received some funding from the IDRC, where we are harnessing heterogeneous COVID-19 data through the data hub that I've just talked about. This data hub is shown in this picture, where we have a common data model, and there are several inputs and processes that go into this common data model. So we have some processes where we have data scientists and data managers that are playing around with the data, but this data can be extracted at some point. And these data, when they are extracted, they can be analyzed and sort of an executive dashboard, which can be used by policymakers and decision makers. But there are a number of processes just before that level is reached. We also have within this Inspire network, we have some supporting activities where we work with the different counties and different ministries to help them build their own capacity for data management. So in conclusion, basically what we are trying to do is that we are leveraging ourselves as APHRC to be an advocate for potential as an advocate for potential hosts for data. And we are doing this with several partners, and we do this through a number of ways. One is to secure the necessary rights and permissions to leverage all the data that we possess or those that we receive. So we get permissions from, we get consent from our funder, from the people who are providing this data to make sure that these data are anonymously made available for researchers to use. We are working with several countries, like I've mentioned, in East and West Africa, to help them support, have a functional data ecosystem within their administrative units. We are also setting up data hubs. I've talked about this for instance, the Inspire network, where we extract and track multiple sources and types of data to be used for informing policy and planning at different levels of governance. We are engaging with partners to utilize the strength of data science and artificial intelligence, so using some form of predictive modeling and data mining to support the decision making for population development in East Africa. While also we are leading with our policy engagement and the communication directorate, we are leading in research advocacy to advance the approaches to leverage data collection, storage, and improve data mining value chains. So those are some of the experiences and from APHRC that we've been involved in, and that's what I could share in these few minutes that the chair gave me. Thank you very much for listening.
Yes, thank you, Dr. You've actually saved us 2 minutes. Thank you, Mwalim. Because of that, I'll invite Madam Joy. I had indicated that Madam Joy, in this context, she's representing JPR, but she is also senior lecturer in the School of Economics at the University of Nairobi. Madam Joy, maybe now you can take the floor. Thank you. Karibu sana, Madam Joy.
Thank you very much. Thank you very much, Chair. Do I have rights to share my own presentation?
Yes, you do, Dr. Kiiru. You can share from your end.
I don't see where. Good. Actually. Okay. Oh, share screen. Thank you.
You can, eh? Fine.
Yes, I can. Can everyone see my screen?
Yes, we can.
Yes, we can see.
Oh, great. Thank you very much. Thank you very much. I'm going to start with the basics, just talking a little bit more about the work that we do. It's already been said that I'm wearing my second hat, which is a part-time job at JPAL. JPAL is a global research institute based at the Massachusetts Institute of Technology in the US. And we have regional offices all over the world. And we have our JPAL Africa office at the University of Cape Town. I am basically at JPAL, I'm at the JPAL Global, which is based at Massachusetts Institute of Technology. And I am based at the Gender and Economic Engines Initiative, where I work as a policy and research advisor. What our work really, what we try to do is not just stop at research and present at these nice conferences and all that, but we try to link our work with policies. And I'm sure some of the stakeholders in this room, we have spoken to them about research priorities and how we can develop projects together and how we can try to see how we can influence policies with that work. So that's what we do. Under the Gender and Economic Engines Initiative, we're working in Kenya, we're working in Uganda, we're working in Ethiopia, and we're working in Tanzania. And we are trying to link all this research. We are also a funder. We also fund research. We work with research affiliates and partners to do research and to disseminate and try to influence policies. So today I'm going to be talking to us about how our approach to research, our approach to dissemination, and our approach to policy influence with a bit of case studies, because JPAL is very particular about a scientific method of testing what really works. And that brings me to my first my first slide, which is about just what JPAL is focused on, and we're focused on poverty reduction. We realized that 46%, almost up 50% of the world, of the world's people are poor. About 3.4 billion people are poor, both in developed and developing countries. And of course, we know that when it comes to measuring poverty, we know that those who live in the developed countries also consume less than $5.50 per day in developed countries are classified as poor. For low and middle income countries, the poverty measure there is $3.2. You can see how we are doing because you're supposed to be there. And for the least developed countries, those who are poor, those who live at about less than $2 per day. So if you look at those measures and you do an aggregate, find that almost half of the world's population is poor. And as Amartya Singh says, that poverty is the lack of choice, that you constrain people, they have no choice but to live the lives of squalor, the lives of need that they live in. So at JPAL, we try to look for scientific methods. We try to test scientific innovations that help to reduce poverty. And so we try to look for sensible interventions that try to fight poverty, and we do so through a scientific approach. We take a scientific approach to test innovations to reduce poverty and to scale up. Is there a comment from the floor?
Let me see. I had a conference.
Do I need to give room for some comment, or is there a background noise I'm hearing?
No, it's not on the floor. It's
Oh, it's on the other side. I'm sorry for that. So I was saying that at JPAL, we try to take a scientific approach to test innovations that work for poverty, and to work with policymakers and influence the scale up of those that work. And we believe that randomized, or rather we have tried and tested and come to the consensus that randomized evaluations take a scientific approach to tackling poverty. And therefore, at JPAL, we try to promote and we try to promote the use of scientific methods of testing what really works, because you find that a lot of money goes into development interventions, and none of those interventions have really been tested, have really been tried to see, do they really work to achieve the objectives? For example, in Kenya, you can name a few. You can look at the Kazi kwa Vijana, the Ajira programs, the Women Enterprise Fund, and all these other funds and interventions, the cash transfer programs which are just happening. Do they really work? Is there something we can do to improve how they work or how they're implemented? We just do the work and we leave it as that. We never come back to take stock. At JPAL, we believe that it saves money and it makes sense to test and evaluate what works and scale up what really works, and that way you can be able to put money where it has bigger impact. And therefore, when it comes to randomized evaluation, I'm not trying to give a lecture on this, but I'm just trying to illustrate, to show you where we say it's a scientific approach. We try to, for example, we recommend that, for example, before we start a development intervention, for example, before we start Kazi kwa Vijana, we want to try and see, does it really work to improve youth employment? Does it create sustainable impacts even after the program is gone? And is it even sustainable? So what we recommend to do is that you randomly allocate some youth to get the intervention, that is get the Kazi kwa Vijana, join the Kazi kwa Vijana program, and you have another group of the Fijanas not joining. But this time you don't just ask them to join by themselves, but rather you randomly allocate them. That way you try to make sure that people do not self-select. That is, people do not just go there because of some of their characteristics that make them join easily. But rather you end up with a sample of both those who have joined the intervention and those who are in the comparison group that is more or less similar in the beginning. And therefore, when you do like that, you're able to know that you are working with, you are comparing a like youth with a like youth. That is, if you look at their levels of education, it is comparable in the beginning. If you look at their socioeconomic characteristics, most of them are very comparable. And therefore, in that comparable group of youth, you can say that in one group you give the intervention, the other group you don't give the intervention, just to see what happens. And therefore, once you give the intervention, there are some econometric methods, of course, I'll not go to them at this time, but there are some econometric methods or some measurements whereby you can be able now to isolate the actual impact of that program on your designated outcomes. Maybe you wanted to see does kazi kwa vijana improve employment, does kazi kwa vijana improve youth skills and networking and things like that. You can be able to measure and see what has been the impact of this program. In other words, randomized controlled trials are able to tell us about causality as opposed to correlation. One of my speakers before me talked about causality and correlation. Not everything that is correlated to another signals causality, but rather with RCT, we can be able to say whether exactly kazi kwa vijana program, for example, causes or reduces unemployment. Or rather, whether it reduces unemployment. We can be able to test that in a very scientific and in a very statistical manner. So in JPAL, we try to promote such kind of research to try and see what really works. And so I want to move from there and show an example of a recent study that we did in Kenya, actually last year in 2020, at the beginning of the COVID-19, when the numbers are really accelerating around May. We know that at that particular time, there were lockdown and a lot of enterprises were affected. And we found that the informal sector was now providing 90% of all employment as opposed to the 80%, which they were providing before the COVID pandemic, meaning that a lot of people had lost their jobs and joined the informal sector for employment. And therefore, JPAL researchers wanted to know the impact of a one-time and conditional cash transfer to vulnerable women-owned small and informal enterprises. We wanted to see, we are talking about cash transfers to affected people. And we know that women-owned enterprises are some of the most vulnerable of our entrepreneurships. And we're like, does it really work? And so we gave them the equivalent of a 1 month in profit, which is about 5,000 shillings, just money that we gave to our intervention. Of course, we first randomized our sample for the intervention and the comparison group. And after that, we were sure that now we are comparing likes and likes. That's the only difference which is going to be there at the end of the outcome is the impact of our unconditional cash transfer. By unconditional, it means that you are giving them money, you are giving people money, and you are entrusting their rationality to use that money in ways that benefit them. And what the research showed is that actually, a lot of those people who got the cash transfers used the money in a very rational manner, if they may use that. Rational money in that money went into the investing into the businesses, in that farm profits increased. Inventory spending, that is spending in the business, increased, that is stocking up the businesses. They improved their diet in terms of improving their food expenditures, increasing their food expenditures. And some of the enterprises which had closed during the lockdown reopened. And we also observed that that is personal protective equipment, the masks, the hand washing and all that, and other precautionary measures, practices improved for those firms who had received the cash transfers. All this we are comparing with those who did not receive the cash grant. That is, profits for those who received the cash grant increased as compared to those who did not. The inventory spending were higher as compared to those who did not. Their food expenditures improved. And there are many more businesses of those who had received the cash grants reopened as opposed to those who did not receive. And we also observed that spending on personal protective equipment improved for those people who want businesses, meaning that they were keen on protecting themselves and protecting their customers. So, but only among those who believe that COVID was a serious health risk. And that implies that, of course, this need to keep sensitizing people on the seriousness of COVID. So what did we conclude? We conclude that cash transfers can assist in economic stabilization during a pandemic, but the result in business activity requires policies that encourage mitigation of COVID. That is, since cash transfers will assist in economic stabilization by expanding businesses and by expanding economic activity, as you do that, then you also need to combine that with policies that ensure that people do not get infected or we do not spread COVID in the course of our economic activities, economic lives. That is, I mean, the balance between lives and livelihood really needs to be in place. This is, as you work for the livelihood, should also ensure that the lives are not at risk. In JPAL, we don't just stop there. We don't just publish in nice articles and leave it there. No, we want to take this research and put it into action. We want to ignite public debate. And how did we go about this? We try to bring this research into public domains and to have discussions with the public and policymakers alike. And therefore, we try to do an op-ed in the Standard newspaper. Of course, we try to translate the technical research to non-technical papers that everybody can understand in JPAL. And we did op-eds in newspapers. Yes, I've had 3 minutes. Yes. We did something in the Standard on 15th of April. We did something in the Nation, 29th of April. We did an interview with that, which featured one of the policymakers, a governor, on Citizen TV, and we have been involved in other forums featuring both technical and non-technical people. And the question is, are there any policy outcomes? Is anybody listening? In Kenya, we're beginning to the policymakers in Kenya are beginning to appreciate the importance of evidence-driven policies. And you can see the only two main policies that the government has adopted in terms of fighting the pandemic. There is the credit guarantee for small and medium enterprises, those that can access banking, and there is also the unconditional cash grants for the individuals and informal entrepreneurs. And as you look at these two policies that Kenya policymakers have taken, they are well supported in research. There's a Kassait study in 2020. There's another paper I read, among other papers that support cash guarantees, credit guarantees, that is. And also our work, among others, supports the idea of unconditional cash transfers to informal entrepreneurs. And also our work recommends that there be a balance between lives and livelihoods, even as we maneuver the pandemic. And we are seeing a lot of that. We're seeing the business and the government of Kenya trying to expand economic activities while at the same time controlling crowds and encouraging people to go for the ABCs of mitigating against COVID, the hand washing, the wearing of masking and all that. We are seeing all that. So yes, we try to engage policymakers, and we try to have them listen, and we are starting to see that our government starting to get interested in research and research findings. So how can you work with us as a finish? Like I said, we are a funding organization. We fund research on development intervention, and we try to build capacity through our several trainings. That is, we have a MicroMasters program, we have an executive training and online courses that we offer, and we try to work with government and partner with government to produce and use evidence. And we try to work funding partners much as we are also a research funder to try and support rigorous research and to work on interventions that reduce poverty. And feel free to get in touch with either me or my colleague, I think she's in this session, Diana Warila, who is, both of us are based in East Africa, working for JPAL Global. Thank you very much. And I'm happy to take any questions if there are any.
Thank you, Malim. Thank you. We had given you 1 minute and I think you are spot on. Therefore, colleagues, that is it. We had 4 panelists, you've heard from them. Now let me take it back to you. Questions, and maybe when you want to raise some question, it's important you give us your name and also who is supposed to respond to that question. I think in the next 10 minutes, we'll be able to wind up plenary and handing over the same to our organizers. Therefore, it's over to you, colleagues, the audience. This is your time. Welcome. Questions, comments, observations regarding the presentations which have been made?
Can I ask you a question?
Yes, Dr. You can go ahead.
Yes, the last presenters actually said he could fund some researches. What kind of group or students or wherever can they fund? Is it in the university? Is it in the private? Is it anywhere? Anybody who has some interest in doing some research you can fund, or what is it? How can somebody access those funds?
Yes, Doctor, you'll come in. Madam Joy, that question is to you. Maybe you'll come in and clarify which areas and how can they be able to access those resources which you are saying that have been set aside for research. Thank you, Doctor, for that question.
Thank you.
Another question, comment? Then, Madam Joy, you can just go ahead and respond to the issues raised by Dr.
Thank you very much, Dr. Musa Arisei, for your question. That's the part that always brings a lot of attention from the audience. And yes, just like any organization, we have a procedure and you have a way that we do things. How we do it is that we like a collaboration. We like to do our research through collaborations. Like, for example, like I said, we are supported by affiliate researchers all over which are based, there are about more than 200 all over the world, based in various research institutions, based in universities across the world. What we do is we try to form partnerships, for example, with organizations, either non-government, state or non-state actors. And we tried, of course, we have priority areas, like if you look at the Gender and Economic Engines initiatives, we are currently looking at issues of women's work and economic empowerment. And what you do is, and within that, we also have priority sub-themes. For example, we are looking at women and paid care burden, gender and social norms, women's enterprise development, and things like that. So what you do is that if you are really, really interested, you can get my email from the organizers, and we can have a one-on-one, and then we can see if there's a possibility of developing a project in our upcoming circle. But you must know from the beginning that it's usually through collaboration with our affiliate researchers and your organization. But if you like, you can take my email and you can have a one-on-one after this.
Thank you so much. Thank you. Thank you.
Thank you, Madam Joy. I think Dr. Arisei also appreciated. Yes, Anne, I can see your hand. You can go ahead.
Thank you very much, Chairman, for an interesting session. I feel, as many speakers have said, funds for supporting populations are really dwindled.
Anne, you seem to be breaking.
I'm saying, can you hear me? Can you hear me?
Yes, yes, yes.
Go ahead now.
Yes.
Yes, I was saying funds for population support have actually been dwindling over the years. Initially, UNFPA actually used to fund most of the population activities in the country, but there appears to have been a paradigm shift, and they started funding mainly RH. So we are trying to see how.
Please unmute.
Doctor, you are muted. Unmute yourself, Doctor.
Okay, I'm sorry. So you didn't hear anything. No, I was saying that the funds have dwindled. I was saying funds have dwindled for population support. And I was just saying that UNFPA initially used to fund population activities, but due to some paradigm shift, they went to funding RH. So we are trying to see how do we get the funds back into population activities, because unless we get funding to fund the population areas, that is the population and development agenda, we will not really get very far with whatever we are planning to do. And as we had, people are at the center of development. So if we don't invest in where the people are, then we are unlikely to achieve what we desire. Thank you.
Yeah, thank you, Madam Anne, for that observation. Madam Anne has noted that resources to support population activities has been dwindling over the years. Therefore, it's upon everybody in this room to start thinking on which mechanisms can we be able to start mobilizing more resources to support population and development. I think that's an observation, but still there is room. If you feel that there is some strategy which you can be able to use in terms of mobilizing more resources, targeting population and development, will be more than happy to receive it. Therefore, Anne, you can now put your hand down because it's still up. Anybody else? Because now we want to wind in the next 3 minutes. Are we okay?
I think
There's another hand.
there was a question.
Yes, Doctor, go ahead.
Yeah, there was a question in the chat to say, what does the law or policy say about making government data available to the public and researchers? I don't know whose question this was addressed to.
Yeah, if you can step in.
Yeah, I was just going to say that, for government data, I think we could look at it in 2 dimensions. There's what we call, there might be sensitive data that has its own protections for maybe what we would call really very sensitive data, government data that includes maybe government secrets or something like that. So that becomes a little bit of a challenge. But when we are looking at population and development data, which is the theme of today, there are several procedures that are put in place that with respect to data sharing policies that are usually put in place. And I think these are usually governed either, I don't know, in Kenya, it could be the NCPD, but also the Bureau of Statistics has in place these things. I think the key point when it comes to sharing data is that you must have the rights, you must have the consent from the data providers to making sure that these data are publicly available. Over.
Thank you, Dr. Ken, maybe you can make it brief because I'm seeing your hand.
Thank you, Chair, and thank you, panelists, for the very good and nice presentations that have been made. Chair, I just want to a few comments very fast. I think the main issue and what is becoming of a great concern, Chair, is that there is a lot of research that is being done and carried out by various researchers and institutions. But I think the main issue is now the availability of this data and even the access to this data, and which eventually lead to a lot of overlap and duplication. And number 2, just to talk about the issue of a one-stop research agenda, which we have as NCPD. I know together with the various partners, we developed a national research agenda on population and development. which gives and provides a lot of guidelines on various activities and research activities which are being raised not only in this session, but in various sessions that have participated in during this conference. So it means that we need to have a concerted effort and deliberate intentions actually to see it to it that one, the research agenda is disseminated widely, and which I'm trying to do in this short period, and then to also call upon various partners to actually help us in implementing this research agenda. Then number 3 is the issue of, especially with regard to automating data and having a national centralized database, whereby, you know, in the era of technology, that is one of the areas we are really focusing on in terms of innovative technological advancement. So that we need to, as a country, we need to have a conversation on how we can have a centralized database, specifically not specifically for population development indicators, but also for other development indicators, so that it can be a one-stop whereby by just a click of the button, you can be able to access various data sets. I know government in other ways, and maybe the department in charge of ICT will be able to tell us that the interventions that are being put in place. But I think as we need to fast track this so that we have a centralized database whereby you can access this data. Of course, considering and factoring in the issue of data protection and safety. I think that is what I have, Chair. Thank you.
Thank you, Ken. I think, Ken, you've raised a number of pertinent issues. And I believe the Secretariat you've really captured, because Ken is saying that how can we be able to invest in issues to do with data? How can we enhance capacity? How can we address issues of technology? Because you are saying that we should be talking about real-time data, which is also complete. You can have some real-time data which is also not complete, which is not adequate, which may not be useful. Therefore, these are the issues which we need also to be capturing. Such that come tomorrow. Sorry?
Yeah. Allow me 1 minute just to say that one thing.
I want to end up. Yeah, just a minute, a second.
Yes,
yes.
I think we need to also think of how we are going to build the capacity for counties so that they can be able to generate and analyze and utilize data in various aspects. Thank you.
Yes, what Ken is saying that we should think as a country. You know, when we talk about a country, some people feel that we are talking about the national. Otherwise, let me appreciate the audience for the questions, the comments. Let me also appreciate the panelists for the job well done. The issues which you've raised, the suggestions which you've raised will be able to be captured. And I'm sure the presentations will be shared by our colleagues in NCPD. Thank you and have a pleasant afternoon. Thank you so much.